We are the Association for Child and Adolescent Mental Health, or ACAMH for short, and this is ACAMH Learn.
I'm Erin Schoenfelder Gonzalez, and one of the focuses of my research is on behaviors and ADHD. By health behaviors, I mean things that we do every day to keep ourselves healthy. That would include being physically active, getting enough sleep, making sure we're not sitting around and being sedentary all the time, and also eating in a healthy and balanced way. We know that children and adults with ADHD struggle more than other people with all of these behaviors. We see that kids with ADHD have a lot higher rates of sleep disorders. But even if they don't have a sleep disorder, they very often struggle with getting tired at bedtime and falling asleep on time, staying asleep, and being more tired during the day. Anybody who's ever had a newborn knows what kind of effect being tired can have on your focus and your executive functioning. Exercise is also an issue for kids with ADHD. You might think, oh, my child's hyperactive, so they're probably way more active than other kids. And at young ages, yes, that can be true. If your child is hyperactive, they're probably moving around more. But as kids with ADHD get older, we see that they actually become less active than other children. By the time they're teenagers, they're a lot less active. And as we move into the teen and adult years, that can increase their risk for developing problems with weight management or even their cardiovascular health. One piece of why kids and adults with ADHD might be less active is that hyperfocus. They can hyperfocus on things that give them a lot of dopamine or are really exciting to them. For kids, screens are usually the number one thing that they can hyperfocus on. But we also hear Legos are often another area, or a craft or just something artistic for many kids. So if your child is really hooked on screens, they just seem totally obsessed with getting access to screens, that's going to take away from their interest in being physically active, but also their interest in doing organized sports or activities. You know, if they would rather stay home and play video games than go to the park or go play soccer, that can become a problem over time. So we've got these three health behaviors. We've got exercise or physical activity, we've got sleep, and we've got screen use. We see all three as really being heavily related. And all three are also directly related to focus and attention. What does this mean for parents? We don't mention all of this to be discouraging. We mention this so that it's something that you can notice about your child and really tune into, and hopefully help set them up to have positive habits as they get older. Kids with ADHD are going to need good boundaries around their screen time and other things that are sedentary or keep them inactive. You may notice your neighbor kids seem to be able to go back and forth and switch interests between their screens and playing with other kids. Your child with ADHD might need you to set up some clear boundaries about how much screen time per day, or just when do we turn off screens at night? What's our screen curfew? What are situations or parts of the house where we're not going to be sitting around on screens? Dinner time, no screens at the table, things like that. And yes, it's going to be a struggle because those screens are so rewarding for them. But now is the time for them to be learning healthy boundaries and healthy habits for using screens. You may notice for yourself that when you exercise and are physically active, you can focus better and your mood is also better. And the research very much supports that. We know in the period after you're active and get exercise, you can focus and make fewer errors and resist yourself from getting distracted more easily. So for kids with ADHD, this can be a tool that can help them harness their focus when they need to. So if there are tough times of your day, like maybe homework time or chore time, where you get a lot of complaining, you might plan for something that involves movement or activity right before that. Maybe getting out for a short walk, or even doing a little yoga video on YouTube before homework time could help your child have a little bit more focus. And we know even if you can't get exercise right before the demanding activity, Exercise throughout the day helps children's brain grow and helps the neurons in their brain become faster and more efficient. Being physically fit also helps your whole body's circulation and functioning. The recommendation is at least 60 minutes a day of being quite active, running around, walking fast, is associated with healthier outcomes for kids. So that might be something for your whole family to think about and work on as a goal. Sleep is a really tricky one. It can be so disruptive to the entire household when your child is not going to bed on time or is not sleeping well. There are many different studies looking at ways to get kids to sleep more. And in the end, the one thing that seems to help the most is actually moving bedtime somewhat earlier. And you may be saying, how could I move bedtime earlier? Bedtime's already a disaster. But sometimes we can hit kids at their natural point of their melatonin kicking in naturally and get them to sleep on a better schedule if we move it earlier. We also want to think about improving sleep cues around bedtime to help our kids with ADHD get more drowsy. They're more likely genetically to be night owls than early birds, so they're going to need more help with this. It's highly recommended that you turn off screens at least 2 hours before bedtime. The screens, even when they're on low light, they activate parts of the brain that lead to wakefulness, and they reduce natural melatonin. So we really want a wind down window without screens and hopefully with lower lights and less exciting and stimulating activities in the home. That's one reason why bath time, reading time, things that are relaxing, game time with the family, if you can do that in a mellow way, those are great things to do during that wind down window instead of screens. So again, we don't want to be doom and gloom about these health risks for kids with ADHD. It's an opportunity to help them right now, not only with improving their focus and their motivation and their mood and their health now, but building habits that they can carry forward with them as they get older to be healthy adults.